Hello everyone. So today we are going to read about different opportunistic fungal infection. So in this video we are going to talk about the Candida albicans, Aspergillus fumigatus and Cryptococcus neoformans. So let us start first about the Candida albicans. So the Candida albicans is dimorphic fungi. So as we have already known that the dimorphic fungi means, what is mean by the dimorphic fungi? The dimorphic fungi means it has two forms. That means it forms the budding yeast at 20 degrees Celsius, whereas it forms the germ tubes at 37 degrees Celsius. So the various diseases that are caused by this Candida albicans, it especially attacks in the immunocompromised patient, and the immunocompromised patient are those patients who are on steroids, who are diabetic, who are suffering from the HIV/AIDS. Also the neonates are the immunocompromised, so they are prone to the Candida albicans infection. So we can see the oral and esophageal thrust. So mainly the oral and esophageal thrust you see in the patient with the HIV/AIDS that are severe immunocompromised state. So it can also cause the vulvovaginitis. So especially those who have the diabetes and those who frequently use the antibiotics, they are more prone to the vulvovaginitis of the Candida albicans. Also there can occur the diaper rash. The endocarditis by the Candida albicans is especially occurs on the IV drug users. There also can be disseminated candidiasis, especially in the neutropenic patients. And also there could be the chronic mucocutaneous candidiasis. So what is the treatment for the Candida albicans infection? So the Candida albicans infection we treat by the oral fluconazole or topical azoles for the vaginal candidiasis, and nystatin azoles echinocandins for the oral candidiasis, and amphotericin B for the esophageal or systemic diseases. Now let us talk about the Aspergillus fumigatus. So the Aspergillus fumigatus shows us the septate hyphae, and it especially branches at 45 degree, which is the acute angle. You can also see in this picture there is the septate hyphae that is branching at the 45 degree. It forms an acute angle. So the various diseases that are caused by the Aspergillus fumigatus are invasive aspergillosis and aspergillomas. So aspergillomas, you can also see in the CT scan that there is presence of the aspergillomas, and some species also produce aflatoxins. So what is the treatment for the Aspergillus fumigatus? The treatment is voriconazole and echinocandins, and it can also cause the allergic bronchopulmonary aspergillosis. So the allergic bronchopulmonary aspergillosis means there is hypersensitivity response to aspergillus growing in the lung mucus, and it is associated with the asthma and cystic fibrosis, and it may also cause bronchiectasis and eosinophilia. Now moving towards the Cryptococcus neoformans, there is the narrow budding of the Cryptococcus neoformans, you can see in this picture, and it is heavily encapsulated yeast, and mainly it is found on the soil and pigeon droppings. So if you inhale the Cryptococcus neoformans, there could be the hematogenous dissemination, and it can also cause meningitis. So various strains are available like Indiaic strain and Muceramaine strain. On the latex agglutination test, there is detection of the polysaccharide capsular antigen and is more sensitive and specific. The various diseases that are caused by this Cryptococcus neoformans are cryptococcosis, cryptococcal meningitis, cryptococcal encephalitis, and the treatment for this Cryptococcus neoformans is amphotericin B along with the flucytosine, followed by the fluconazole for cryptococcal meningitis. So we have to give the therapeutic dose of the amphotericin B, flucytosine, followed by the fluconazole for the cryptococcal meningitis. So I hope you understood this topic on opportunistic fungal infection. In this video we just discuss about the Candida albicans, Aspergillus fumigatus and Cryptococcus neoformans. So in the next video we'll talk about the various other opportunistic fungal infection like mucor and rhizopus species. Also we'll discuss about the pneumocystis jirovecii and sporadic skin. So this much for today. I hope you enjoyed this video. Thank you.